Hi everyone. I know it's been a minute since I posted a video, but I did want to come and post one today because I know there's been a lot going on with the COVID-19. And so I want to talk a little bit about exercises we can do for our respiratory system and for our lungs. So I realize that COVID-19 is a virus that attacks the respiratory system. So one of the things we can work on is to try and help keep our lungs open. In one of my previous videos, I've discussed doing diaphragmatic breathing. And so that's the first thing I want to talk about, because practicing a diaphragmatic breath can really help the lungs to fill, get the alveolar to open up, the different parts of your lungs to open up. You'll get some good rib movement, and it'll help strengthen the diaphragm. So to do a diaphragmatic breath, what I want you to do, I'm going to stand up so that you can see my hands on my belly here. First thing I want you to do is place your hands on your belly. You're going to take a deep breath, inhale through your nose and let your belly rise. So inhale, push your belly out, and then exhale through pursed lips, bring your belly back in. Again, inhale and exhale. Inhale and exhale. And as I'm inhaling and exhaling, I'm inhaling through my nose, my belly's rising, and I'm exhaling through pursed lips and pulling my belly in. So that's the first thing. The other thing you can do is something called percussion around the lungs. And so to do percussion, we're going to take our hands and make them in the forms of a cup, right? So if you can see, my hands aren't flat like this, they're cupped a little bit. And typically you would do this to someone's back, or someone would do it to your back. But because if you're at home by yourself, or maybe if you're there with someone, but I'm doing for solo treatments. If you're at home by yourself, you can do this treatment to your chest. And so you're going to cup your hands, and you're going to do kind of like a rhythmic patting with your hands in this cupped position along your chest. Oh, I didn't wear any of my rings, so make sure you remove all your rings, because that can be uncomfortable. And it's not like a hard, it's not a hard hit. It's just kind of a, I don't know, I guess moderate. And you're just going up and down over the area where your lungs are. So you can just follow where your ribs go to, because that's approximately the length of your lungs. And you can do it for a few minutes, like about 3 minutes on each side. And just keep going in the rhythmic pattern. Cupped hands. And that helps to kind of loosen up any fluid in the lungs or anything like that, to help kind of get it moving around. You can also do it along your sides here, okay, on both sides. And at the end of that, go ahead and practice those deep breaths again, that diaphragmatic breathing, because that'll help fill the air, fill the lungs with air, and exhale, and hopefully get out anything that's maybe caught or congested in there. The other thing you can do are just some exercises for basic rib mobility. So you can do things like chest circles, where you just kind of come around and do full circles clockwise, and then counterclockwise, pulling all the way around 10 times in each direction, just to get some of that rib mobility going on, that chest mobility, get things moving. And then a good chest opener stretch, if you're just at home sitting, is to go ahead and place your arms behind your back, like so. And then you're just gonna pull your shoulders back and just kind of work on stretching those pec muscles and opening up your chest. And you can hold that for about 90 seconds as well. Okay, just like one time a day. The other part of this is moving, some aerobic exercise. I know we are all confined to our homes right now, and I please everyone, stay home and stay safe and keep safe. But we're confined to our homes, and so I know getting aerobic exercise might be difficult, but if you have the tolerance for it, you can do things like practice going up and down stairs if you have stairs in your home. If you have a treadmill, great, get on your treadmill. If you live in a neighborhood that is kind of quiet and you can keep at least 6 feet away from everyone, then taking walks outside, maintaining your distance, to just kind of get some moving that way is a great idea. but move, get some cardiovascular exercise. That's one of the things that helps your breath and it helps get your blood going, and it's just good overall. So I want to keep this brief. There are, I'm sure, a million other things you can do, but those are just some general tips. All right, everyone, stay home, stay safe, take care.